So each year at ACP, I do an update on drug interactions and side effects that have been important in the past year. And it's hugely important for primary care physicians because we prescribe a lot of medications. We need to recognize when to stop medications, and that's much of what we do as doctors. The most common error out there is probably giving too much insulin if you look at what goes on in hospitals. I didn't cover that because I think our audience is so aware of that, and those are usually systems errors. But as far as medications, I focused a bit on Quinolones because this group has come under great scrutiny by the FDA in this past year. Labeling changes have occurred to remove it as a regular and approved treatment for cystitis, for acute sinusitis, and for acute exacerbations of chronic bronchitis. The real worries on Quinolones that have been emphasized in the last few years have been neuropathy, because it can be permanent and terrible. Some new noise that could it possibly be associated with aortic dissections, which is a very, very worrisome thing, and then a reminder of how common tendon-related problems are with Quinolones. Some other ones, I look at what has the FDA told us in the last several years and sent us Dear Doctor letters, because lawyers are very aware of these letters, and they feel that as physicians, if we are told by the FDA that a drug is dangerous, we need to know that, and if we prescribe it without telling the patient and something bad happens, then we're responsible. We can certainly argue whether that should be true, but I try to highlight some of those. One example is a very common drug that's prescribed for depression. Aripiprazole goes by the trade name Abilify. That drug was recently linked to compulsive gambling, compulsive spending, and a number of other things that are very, very difficult for people if they have that side effect. And many lawyers are aware of this and are already starting to advertise for it. So I highlighted that a bit about the recognition that this is a side effect of that drug, and it's a bizarre side effect. It's not a typical side effect we think of. We think of normal side effects as nausea or rash or something like that. We don't think that we take a drug and we suddenly run to a casino. So that was an example of a newer FDA alert that I tried to highlight. Other things that I covered that I think have been around forever but continue to be difficult for physicians are how to use anticoagulants safely. It always is at the top. Number one reason that patients get hospitalized from drug interactions are interactions with warfarin. And I highlighted a few that are known and a few that aren't known. The most common one that's still out there, and probably the most common reason for hospitalization for drug interactions with blood thinners, is the interaction with trimethoprim sulfa and warfarin. Trimethoprim sulfa is so commonly used now for skin and soft tissue infections because of a concern and fear of methicillin-resistant Staph aureus. And this, for many years we've known, has a very powerful interaction with warfarin, where it can double the expected anticoagulant effect of warfarin. And being aware of that and avoiding, if at all possible, and if there are no other choices, to dose reduce the warfarin if you start somebody on trimethoprim sulfa. Another interaction that's super common that many people don't know is that when we give steroids such as prednisone with warfarin, that it can raise the INR and can cause problems as well.